Hello, everyone, and welcome to today's presentation of the American Rescue Plan Act of 2021, planning for additional funding for the DD waiver. My name is Abigail from DDD's training unit, and I'll be assisting you today throughout today's webinar. I'm pleased you took time out of your schedule to attend today's presentation on such short notice. Before I hand over the microphone to our presenters, Mary and Stephen, I have a few housekeeping announcements to go over. This webinar will be available and recorded and available for you on demand at health.hawaii.gov/DDD. For today's presentation, we will be using the chat function to provide you with valuable links and handouts for today's presentation. Simply locate the chat window, either located on the bottom of your Zoom control box or above. Please also locate the Q&A function. This is where we'd love to hear for your questions, and our team will be answering all questions at the end of today's presentation. So type your questions away and we will be answering them. If we don't get a chance to get to your question today, we will be providing you with an email address so you may reach out and ask whatever questions that you have. Our live webinar will be beginning shortly. So without any further ado, I will go ahead and turn this over to our administrator, Mary Brogan. Mary?
Okay. Good morning, everybody. Thank you so much for joining us. I know this was real quick notice that we were going to have this webinar, but it's a fast-moving process, and we really want to share as much as we can with you and engage you in our planning process. Next slide. So you're going to see me looking back and forth because I have trying to be fancy and I have two screens going on here. Basically, our overall agenda is to introduce you to what the American Rescue Plan is. In order to qualify for the funding under the American Rescue Plan, what the requirements are for states, then what the allowable uses of the funds are, those activities that are allowed, our pathway for strengthening home and community-based services in Hawaii, which are basically the waiver services for us. Looking at some of the questions to ask ourselves about how should Hawaii invest in our system using these funds? What's the best use of them? And then the process for providing initial input. So I will be presenting along with Stephen Pawlowski, who many of you know, and we're going to be tag teaming on this presentation. So next slide. So I'm going to start with an overview of what's called Section 9817 of the American Rescue Plan, and presenting on how it's intended to be used to enhance, expand, and strengthen home and community-based services. Next slide. So what is the American Rescue Plan? It's a, or the ARP, A-R-P. It's a COVID relief law passed by Congress, signed into law by President Biden on March 11th, and it's designed to build pathways towards economic recovery during the period of the pandemic. It provides some immediate pandemic-related relief, including supporting the national vaccination program, providing immediate relief to families and to struggling businesses and communities. And it was overall funded at $1.9 trillion. There are Medicaid provisions in the ARP, and those are designed to increase coverage, expand benefits, and increase federal funding for state Medicaid programs. So the ARP has many, many sections, and section 9817 or 9817 of the ARP allows states to tailor the enhancement that they want to make to home community-based service programs. And these enhancements will be based on the needs and priorities of the people that are served, while protecting and strengthening the HCBS workforce, safeguarding financial stability for HCBS providers, and accelerating reform and innovation. So those are the core purposes of Section 9817. What it does is it provides states a 10% increase in the federal share of Medicaid-funded home community-based service programs. And the period of time that this 10% increase in the federal, what's called the FMAP, the federal share, is started on April 1st, 2021, and goes through March 20th, 2022. So that's the period of time that we can collect the additional 10%. So essentially, Medicaid pays a larger share of each claim, which is called the FMAP, which allows states to use the funds attributed to the 10% bump for the purposes of the law. Next slide. So what does Section 9817 of the ARP require states to do? So in order to use the 10% funding, these are the basic two requirements. So in blue, it's to, the additional federal funds must be used to supplement, not supplant, existing state funds in HCBS programs. So supplement means the funds need to be in addition to, and supplant means it can't take the place of existing state funding for the waiver. So that was a condition under the law. The other core condition is in the green, which is states must use the enhanced funds to implement or supplement the implementation of one or more activities to enhance, expand, or strengthen Medicaid HCBS. So those are the two core requirements for using the funds. You can't supplant existing state funds, and you have to implement to enhance, expand, or strengthen your program. Next slide. So as mentioned previously, the law went into effect on March 11th. And since that time, states have been waiting for the sub-regulatory guidance from CMS, from the Centers for Medicare and Medicaid Services. And that guidance was issued a week ago on May 13th in the form of a state Medicaid director letter. Prior to issuing the guidance, CMS did hold a listening session with the states and stakeholders and took a lot of input from the states, and we were able to participate in that. And we feel that the guidance did reflect a lot of our input, although there are a few remaining questions that were posed into CMS. So that guidance was issued a week ago. The primary provisions you can see here in the bullets. So this is what the guidance contained. So how states will demonstrate compliance with the supplement, not supplant requirement. That's very important. It also includes the time frame to use the funds. So we gave the time frame to collect the funds, but there's also a specific time frame to expend the funds. And then it gave a lot of examples of allowable use of the funds. Then it requires states to submit an initial spending plan by June 12th. So very quick turnaround. So basically, states had a month to develop this plan and also to engage the public, such as what we're doing here before we finalize the plan. And then the other thing the guidance did was to expand the retainer payment policy. So the providers on the call will be familiar with the previous policy, and what it does is it expands the retainer payment policy. So we're going to be going over all of these things in this presentation. And the guidance is available at this website, which we'll also put into, Abby, it will put into the chat in case you want to look at the guidance yourself. And we'll also be posting that on our website. Okay. And the next slide. I'm going to turn it over to Stephen for the next few slides.
Great, thank you, Mary, and good morning, everyone. I'm Stephen Plowski with the Burns and Associates Division of Health Management Associates. We're a consulting firm that's been supporting DDD for 6 or 7 years now on a range of issues, particularly related to provider reimbursement and general financing issues, which is why I've been asked to provide some of the technical details on this guidance that's come out related to the ARPA funds. The first thing that we wanted to spend just a couple of minutes talking about is further information about that supplementing rather than supplantation requirement. As Mary said, that's one of the key elements of this particular provision. The additional funds do come with strings attached, and this is the primary one, which is a little bit different than how the federal government has sometimes increased Medicaid funding. It's been fairly commonplace during downturns for the federal government to provide more Medicaid funding to the states, more federal dollars. And oftentimes what states have done is taken those federal dollars and repurposed the state dollars to other programs to fill in shortfalls elsewhere. In this particular case, though, Congress was very intentional to say that we'll give you additional federal dollars, but you have to keep all of the money within your home and community-based services program. That guidance that was issued a week ago provides information about the things that states have to do in order to meet that requirement, and that's here on the top of the slide. So effectively, in order to ensure that we're not supplanting additional or existing resources, the state cannot implement any stricter eligibility requirements. So we can't add additional requirements to the eligibility guidelines for the DD waiver. Similarly, any services that were covered as of April 1st must remain covered. So the states are prevented from taking any services out of their waiver programs during the time that these additional funds are available. And then similarly, the state cannot reduce provider payments below those rates that were in effect on April 1 again. So it really is looking at the 3 core elements of any waiver program: eligibility, services, and rates. And they're saying that you cannot do anything that was more restrictive than what you were doing on April 1st, because to do so would mean that you're taking dollars out of the system, and that's contrary to the legislative intent or the congressional intent of these additional funds. That being said, Congress realizes and CMS realizes that these programs are constantly changing. So it's not that the programs are set in stone. Eligibility, services, and rates cannot be reduced, but they do recognize that there will be natural changes to programs. So for instance, utilization changes from year to year. The types and amounts of services that people use will vary based upon their interests and needs. And that's particularly going to be true over the next several months and the next couple of years as we continue to emerge from the COVID-19 pandemic. We recognize that there was a shift in the services that people were using during the pandemic, and as vaccination rates improve and hopefully the pandemic continues to ebb, we'll continue to see probably a return to more normalcy in terms of the services that people are utilizing. And so they're not going to be holding that against the states when these utilization or these service patterns change. Similarly, individuals' needs can change from year to year, and that might change the amounts of services that they have access to. So if there's a difference in someone's assessed needs, that might have an impact on the types and amounts of supports that they're going to realize. So those types of natural changes to the programs continue to be permitted. And then additionally, as indicated here in the presentation, there are a number of temporary provisions of the existing IDD waiver program that are specifically related to the pandemic and that are scheduled to effectively go away over the next several months after this temporary authority ends. And so providers in particular on the call will be familiar with some of those flexibilities that the division has established under what's called an Appendix K authority really just an amendment to the existing waiver that allows the states to do some things that they cannot ordinarily do. But those were always meant to be temporary measures, and except for those handful that the state intends to continue, perhaps some more flexibility around telehealth that's included in the waiver application that's pending before CMS. But most of those changes were meant to be temporary, and it is okay from a federal perspective for those temporary flexibilities to expire when that public health emergency declaration expires. And finally, wanted to reiterate the point that's been made several times already, because it really is the fundamental elements of this particular part of the American Rescue Plan. And that's that the funding that's being provided for this purpose must be used on home and community-based service related services and infrastructure. And that just goes back to the whole purpose of this slide, which is we can't take money out of the system. It must remain in the system and be used to expand, enhance, and strengthen home and community-based services in the state of Hawaii. The next thing we wanted to talk about was the size of the pot of money that we're working with. We wanted to be very transparent with the community about how much it is we're looking at. So Mary already indicated the kind of technical mechanics behind the additional funding that's coming in. It relates to the federal share of expenses. But for most of us, what's important is the bottom line. And the bottom line is we're looking at about $30 million of additional funding in the IDD waiver program, which on the one hand is an awful lot of money. But on the other hand, this is over a 3-year period of time. And considering that the waiver is about a $150 million program, that really isn't a dramatic amount of money. So a lot of good things can be done with $30 million, but I think we need to recognize the context that we're talking about spreading that out over a 3-year period, and that this program already is about $150 million per year. So $10 million increase, give or take, on an annual basis against a $150 million program. So certainly a lot of opportunities to make really smart investments to expand, enhance, and strengthen the program. But want to keep in mind that we're talking about a pretty sizable program already. And so we need to be thoughtful about how any investments are going to be sustained over time, which is one of the other things that CMS expects the states to speak to as part of their spending plan, which Mary will be talking about in a couple of minutes. And so when we're talking about sustainability, that really is a combination of making investments in one-time enhancements to the program, so those that will not have a continuing price tag. And for those that are intended to be continuing, having a strategy to make sure that we can secure additional funding to support those initiatives over the long term. Once these federal dollars go away in about 3 years, what's the strategy going to be to maintain those investments? And so that's going to be part of the process that the division is going to be working through both internally and then with the stakeholder community to think about how targeted investments can be made that will leave the program in a better place 3 years from now than it is today, without creating any sort of what we call funding cliffs, where we do good things and then the money runs out and we revert to where we were. We want to avoid those sorts of outcomes. And then one other final slide that I have to talk about now is around the issue of retainer payments. So this really is a provider-centric issue, and it was crammed into this guidance letter. Really, it doesn't have a whole lot to do with the American Rescue Plan, but I think CMS thought as long as we're issuing a state Medicaid director's letter on home and community-based services, we might as well cram in something about retainer payments as well. So what this means is for those providers who are unable to deliver services because people are unable to attend their programs, the state set up a system where providers can continue to bill. And there's a lot of detail around that I won't get into here today in terms of how those dollar amounts were established. But the bottom line is it was quickly recognized that ADH programs and CLS programs and even PAB services in some circumstances were not being able to be delivered at historical levels. So retainers were established for ADH, CLS group services, job coaching, and then residential habilitation services, so that those programs could be sustained once the pandemic ended. DDD, like most states, although not all states, like most states, established those retainer payments, but there were federal rules around those. And one of those federal rules were that it could only be in effect for 3 30-day periods. And that's based upon historic disasters that the federal government has allowed these retainer payments to be billed for. So you can think about things like floods or hurricanes that have happened in other parts of the country that have really knocked services out for a period of time. So based upon what the federal government has historically seen for these disasters, they said 30-day periods is going to be adequate and appropriate. Of course, the pandemic is like something we haven't seen in many decades. And they recognize that, and they're giving additional flexibility to states now to establish a new period of 30-day periods of retainer billing. Again, that doesn't certainly cover the full length of time that providers have been grappling with the pandemic, but it's more flexibility than has ever been offered before for retainer payments. So if Hawaii or any other state chooses to adopt that option, a couple of rules still apply. First, there'll have to be a new application to the federal government to seek approval, which we anticipate would not require any, would not be a problem, but still a requirement. There's also a number of what the federal government has called guardrails in place. And again, in really simplistic terms, what we're talking about is providers have to effectively retain their staff. It doesn't make sense for providers to get these retainer payments if they're not paying their staff. So there's requirements around staff retention and wage maintenance. And then there's also a lot of concern at the federal level about not duplicating payments. And this is largely an issue for 2020, not 2021, when there was a lot of additional federal money floating around for things like the PPP loans to small businesses and the like. But those duplicate payment guardrails will remain in place as well. If a state chooses to do these additional retainer periods, it can be retroactive back to January the 1st. So that's certainly something that the state's interested in getting feedback on over the next several weeks as it considers whether or not to adopt this particular additional flexibility that has been authorized by the federal government. So with that, I'm going to turn back to Mary, and then I'll be back in a couple of minutes to walk through a brief survey that we have that we're asking stakeholders to complete to provide some input to how these $30 million can be used.
I just wanted to add one thing that we forgot to probably put in the retainer payment slide, which is it applies only to calendar year 2021, so from January to December. So in the guidance that CMS issued, there are a number of appendices, but two of them really apply to those types of activities that states can consider in planning for use of the funds. So the first appendix is Appendix C and applies to addressing COVID-related concerns. So it provides examples which are not exhaustive. You can do other things if CMS approves, but these are the types of examples that they provided for states. So for example, during the COVID period, if a state wanted to provide new or additional services during the public health emergency, they could choose this option. So I'm going to kind of go across the different boxes from left to right. Under provider payment rates, CMS provided a range of possible activities, such as increasing leave benefits for direct support professionals, things like hazard pay, overtime pay. You could fund physical or operational changes to an ADH program to more safely deliver services. And you can increase rates for services during this time. For this option of increasing provider rates, CMS expects that any increase in rates will increase the compensation of direct support professionals. So that's the requirement that would be attached to that for the public health emergency period. Other activities are listed on these slides and include buying supplies and equipment such as PPEs and paying for testing, workforce supports such as training, providing incentive payments to recruit people, because as we know during this time, there is a challenge to hiring people and really making sure that we have adequate staffing. Going down to the next row, an example of an activity that you could do is providing supports for family caregivers, buying assistive technologies and other things to mitigate isolation of waiver participants, transition supports, and these are for people that might be in like a nursing facility during the pandemic and need to transition to a new setting, providing outreach to people about the pandemic or about vaccines, such as educational and language assistance, and providing access to vaccines. So these are examples of types of activities that you could choose addressing COVID-related concerns, or it could be other things. So this is really the time in the presentation to start thinking about what Hawaii might do. So the next slide are in Appendix D of the guidance. CMS offered examples of activities that address more capacity building towards longer term strengthening of the HCBS system. So it addresses new services and also provides other examples that could be described as more longer term infrastructure to strengthen systems. So a little bit different than the short term during the public health emergency, but what are those strategic things that states want to choose to strengthen, enhance their systems? So again, reading across the top row, new services that you don't currently have in your array, implementing strategies to improve the front door access to the waiver, such as putting in toll-free telephone lines, informational, pushing out information about how to access services, developing automated screening and assessment tools, and other kinds of things to help people to gain access to the waiver. The next box is really about strengthening your assessment tools and processes and advancing person-centered practices and training, which is something that might be a strategic use of these funds. The other example activity is investing in quality improvement and quality management, training on how to do quality management, upgrading critical incident management or AER systems, and overall advancing the quality of services. The next box is an example of activities around developing partnerships across systems, strengthening provider networks, especially to address unmet needs in your system. And an example would be to have partnerships to develop housing or transportation options and that kind of thing. Going down to the next row, examples of activities, caregiver training, building more respite options for people. The next box would be about expediting eligibility and improving eligibility systems, because that's a common pain point for systems. The next one reads community transition and expanding capacity. And from their example, it really is supporting transition and provider capacity to convert from more institutional types of settings, like ICF settings to HCBS. So to do that conversion, and another part of that expanding capacity would be to provide financial incentives to expand the number of staff, retention rates, and skills of the direct care workforce. And some of the other examples are listed here. Improving cross-system data integration. So say if we wanted to integrate DD waiver data with medical systems waiver. So we would have both of them together to become a little bit more integrated in our service approaches, to build capacity around your IT systems, telehealth capacity, the use of telehealth, to provide more access to equipment and devices for people, and to enhance care coordination. So that's the kind of list of activities that CMS issued. Again, this is a long list, but CMS points out that it is by no means an exhaustive list. So states can choose other activities in their spending plans. Next slide. So one of the other features of the CMS guidance is that there are requirements around having a spending plan, an initial one, with updates quarterly, and to be able to report on the spending. So it's technical in the nature of how activities are reported, but the initial spending plan, along with assurances that you are meeting the requirements of the law, currently are due to CMS on June 12th, 2021. So for DDD, that means we would want to get it to MedQuest a number of days earlier. There is some chance that CMS may change that date, but we have not heard yet. So that's the date that we're really shooting for, to have our plan ready. Again, really fast turnaround for us. So then what CMS does is they take your initial spending plan, they review it to see if it's in alignment with the requirements, and they will approve it within 30 days. And then there are quarterly spending plans where you can update. You can make updates. So again, like I said, the guidance includes instructions for doing the reporting and claiming. They want to know, and they're going to make public what states are doing. So in this initial spending plan, this is where we develop our activities and also develop our budget, because really it's, you have to have the state match across the 3 years. So you have to balance what's coming in and the spend. And depending on what we include, we more than likely will need a legislative strategy to address the requirements for supplementing, not supplanting. So it may be different, a different way of approaching our budget, because what happens in the state budget currently is we lapse any funds that are left, and if we haven't spent those funds that really were part of our spending plan, we would have to have special permission through a legislative strategy. We also have to do anything that we do, we have to do within the state procurement guidelines, which we all know and love. So those are the basic requirements for the spending plan, which is what we're going to be working on in the next few weeks. And we're going to next be talking about how should we think about that spending plan. So it's really the how might we invest as a state, as a system, building on our current initiatives and the waiver requirements to quote, expand, enhance, expand. I wasn't ready yet. Or strengthen the IDD waiver. So those are, I just wanted to show that this language comes from the law again, enhance, expand, or strengthen. So that's one of the key frames that we have to think about when we do the planning. Okay, now I'm ready. Thank you. So these next few slides are going to provide some of that planning framework and those things that we're going to anchor into in our planning. A lot of these system commitments were framed during the Santa Summit. Some of you know about that, participated in it. So some of the work that we've done in previous years are really preparing us for this planning and how we are going to honor our system commitments that we've developed together. So what the slide talks about at the top is what our vision is, which is individuals with intellectual and developmental disabilities have healthy, safe, meaningful, and self-determined lives. So that's the first part of our commitment. And then our commitments are that the system is adequately funded, our services are managed for fairness and equity, that what the services that people get are fair and equal across people with common needs, that we embrace innovation and partnerships, and that partnerships with families and other stakeholders are nurtured, that we work on them. And the system has effective programs and skilled staff, which was something we heard loud and clear in the Santa Summit from families. The next slide. So in possibilities now, again, these are elements for us to anchor our planning into. At the core are person-centered practices and person-centered approaches, and staying true to that. And around that are the infrastructures and features of the system to support this to happen. So it talks about having adequate system infrastructure, using individual support budgets, employing best practices, ensuring that we have sufficient rates, because that's a core requirement of the waiver, that we pay what it costs to provide the service. That we have a robust service array, that there are enough services to meet the needs across our participants and families. Another core commitment and feature infrastructure is community integration, not only because it's a federal requirement, but because that's the direction that we are moving in. And to have accurate and reliable assessment. So again, these are, as we plan on how to use the enhanced funding, these are our anchors. And next slide. So in DDD, we often use this term, this framework called how might we. It allows us to ask those questions that are important to ask before we answer them, to really to pose the challenges out there. So the task at hand for all of us in the next few weeks as we develop our spending plan is, how might we enhance, expand, or strengthen the IDD waiver? And keeping these questions in mind, what new services and supports are needed in our system? The next question is, how can we further support individuals to live their own good life in the community? What's missing? What do we need? What supports do families need? How might we strengthen the direct support professional workforce? We need to sustain, we need to be able to address having skilled and competent workforce. And related to that is, how do we improve the overall quality of services? And then how do we ensure that the IDD system is adequately funded in the long term? So those are collective challenges that we're trying to work on all the time, but then how might we use this opportunity to then enhance, expand, or strengthen on these things? So just again, a framework for thinking, planning. So I'm going to now turn it back over to Stephen to present to you the process for providing input for our spending plan. Stephen, thank
Mary.
you.
And hello again. And to clarify, this is the process for providing initial input. So as Mary indicated earlier, we have a very quick turnaround to submit this initial spending plan to CMS, which is why this call came together so quickly and why we're looking for feedback on an also very tight time frame so that we can meet the federal requirements to get that initial plan in. That being said, as Mary also indicated, that there will be opportunities for the state to adjust that plan as more information becomes available or priorities shift over time through those quarterly plans. Certainly, the initial plan will provide, I think, a high-level overview of the areas where the state's going to look to make investments, but details will certainly involve opportunities for input from a wide variety of stakeholders as actual investments begin to move forward. So I'm going to take control of the presentation just for a moment and share a copy of the very brief survey that we've put together. Just give me one moment to pull it up on my screen. So we put together a very brief survey, and the purpose is really twofold. The first is to provide some perspective on the priorities that stakeholders have for investments. So we have a number of categories that follow those that Mary just talked about on the previous slide. And then within those categories, we're looking for any specific suggestions that you and others might have. So certainly the division's been thinking about this certainly over the past week, and then even ever since the legislation passed in March, while we were waiting for guidance to know specifically what types of areas investments will be permitted in. But we also recognize that there are likely to be things that we haven't thought of that are important to individuals and families receiving services, service providers, staff within the division, and other stakeholders. So the survey is looking to get those ideas so that we really have a comprehensive listing of potential options that can be further debated. We've designed the survey to be very quick, so we say it should take no more than 10 minutes. I'm hopeful that it'll take no more than 5. And for that reason, we're asking for it to be submitted pretty quickly as well, so that the division actually has an opportunity to review the feedback and think about it before it submits that initial plan to CMS by June the 12th. So giving folks a little bit more than a week to complete the survey. I'm going to walk through it. It really only consists of 4 questions. The first is asking for the respondent's role in the DD waiver program. So we're looking for feedback from all of these groups: individuals receiving services, a family member or guardian of someone who receives services, service providers, staff within DDD, and then other folks who could be advocates or other interested parties. If you do select this other category, we're asking you to tell us what your role is within the system. We're not asking for any identifiable information, so you don't need to provide your name, and we're not asking for any further demographics, but it's important to the division to understand what the priorities of these different groups are, because although certainly we all want to move in the same direction, we might have different ideas about how best to get there. So we do want to understand what's important to family members, separate and apart from what's important to providers. Just so that we don't get any bad information in the system, I'm going to write in tests so that we can exclude this when the information is downloaded. The next question is asking you to select your top 2 priorities for the DD waiver program's additional funding. So we've divided this into 6 broad categories. Things like adding supports to the program. Are there new services or other supports that you think would be important to individuals? Specifically, do you think investments ought to be made to helping people with disabilities find work in integrated settings? That was a challenge before the pandemic, and we understand that it's become even more challenging during the pandemic. So given the focus on helping people move into employment, is that something that we ought to think about how best to invest these dollars in? Are there different supports that we ought to establish specifically for families who care for people with disabilities? We understand that that's obviously taxing, and as with many things, became even more taxing during the pandemic. So there are other supports that aren't currently available through the waiver that would help families continue to provide support, since that's obviously best for individuals with disabilities. Are there things that we ought to do to strengthen the workforce of direct support professionals? Mary mentioned some of those things during her early remarks in terms of looking at compensation, providing greater benefits or bonuses or hazard pay and the like. Are there things that we could do to improve the quality of services? So we have some ideas about things like improving training, person-centered planning for staff and for providers. How about assisting providers become HCBS compliant? And those are a couple of ideas that we've come up with, but certainly are there things that you, the community, think would help to improve the quality of services? And then are there investments that we ought to make specifically in provider reimbursement, another topic that Mary mentioned a moment ago? So out of these 6, we're asking you to choose your 1 or 2 highest priorities. And just for illustrative purposes, I'm going to talk about improving the quality of services as well as increasing supports for families who care for people with disabilities. For those items that you select, we're asking you to tell us what your specific ideas are in those areas. So we've given you some of our ideas, like for the newer increased supports for families, that could be assistance with housing or transportation. And if those are important to you, you can certainly include that in your written response here, but we're asking you whatever you think is important really under the sun at this point, that would help to, in this case, improve supports for families with disabilities. And I'm just going to type in test so that we can eliminate this information. And then the same thing is for the second priority that I selected. What would I do or what would you do to improve the quality of services? Again, we've given you some ideas, but we don't want you to limit your thinking to our ideas. The whole purpose of giving you this text box is for you to tell us what you think is important. And although it's only here on a single line, this can accommodate quite a bit of content. So be as verbose as you would like to be. We're looking really for all of your feedback as detailed as possible so that we can formulate the best plan for people with disabilities within the state. And then the last question is, there might even be things that we haven't thought of in our 6th category. So what else would you like the division to be aware of in terms of your priorities or suggestions for the use of these additional funds? Again, we've intentionally left this very high level. We don't want to drive you into any specific consideration or any specific idea. We really want to hear from you, because although there's a lot of smart people at the division, we know there's a lot of very smart people in the community, and certainly they're the folks who are closest to the services. So we want to make sure that we're providing you really maximum flexibility to provide feedback to the division about where you think investments would be best targeted. And that's it. So certainly if you spend a lot of time typing, which we encourage you, it could take up to 10 minutes, but really we're hoping that this survey is quick and easy and gets wide participation from all sectors of the DD stakeholder community. With that, I'm going to turn it back to Mary for concluding remarks, and then I know there'll be time for questions and answers.
I saw a question come up on the chat or on the Q&A about where you can find the survey. So a couple of places. If you click on the link in the chat, it'll take you there now, but then you'll probably start taking it and not listen to the rest. So I would encourage you to do that. But we will post it on our website. And how I find our website is ask Google DDD Hawaii, and it'll take you right to our website, and it'll be the survey as well as these slides. If you need them to refer to, will be on the first page of our website. So again, what we're going to be doing next steps is to collect information. We are also going to be probably convening a few focused discussions with different people to dive down into some of the options. And I think that at this point, we'll leave the last few minutes for Q&A. So Abby, I'll turn that over to you.
All right. Thank you, Stephen and Mary. So for those of you folks who are paying attention to our Q&A panel, we have included a link to the survey. But again, once, like what Mary said, please feel free to visit the website as soon as we're done with this webinar. If you have any questions, we will be more than happy to take them today. So again, if you don't know where our Q&A panel is, it depends on how you're viewing today. It might be above, it might be below, but go ahead and click on the two talking bubbles, and then it says Q&A. All right, so let me go ahead and pull up some of the questions that we have here. Let's see, we have somewhat, is DDD addressing, is this gonna address DDD case manager shortage?
So as many of you know, we had a number of case managers position eliminated by the legislature in the last session, the session before this last one, the fiscal year 2020. So I think that this is going to take a combination of a legislative strategy, because we were, even with those positions, we have a constantly growing caseload. So we're going to have to be able to explain that. But I'm sure we can look at ways that to support our case managers. And I think the best thing is, if people have ideas about this, please enter it into the survey or get in touch with us.
All right, thank you, Mary. Next question we have is from Crystal. Will this recording be available to rewatch on the website before the survey is due? Yes, it is. I can answer that question because that's me. Yes, so this presentation will be available to watch on our website. If you are not familiar with our website, it's health.hawaii.gov/DDD. And then, like Mary mentioned, the link will be available on the front page. And then we also have a various list of news posts and events available for you folks to easily reference. Thank you, Crystal. Same thing goes. We have multiple questions about how our families will be informed about the survey. Next we have, go ahead, Mary.
So again, we will have it on our website. Please feel free to forward it to anybody that you know. As well, during the pandemic, we were able to collect a lot more emails than we've ever had before. So we will email everybody we have an email for with the survey.
All right. Let's see. We have, Stephen, this is about the survey. First of all, they would like to know, what is your role? Consultant, the man. And will the survey input be anonymous?
So yes, the survey input is anonymous. We intentionally didn't ask for any information about names. That being said, we are looking for the roles, that very first question, because we do think it's important to understand the different stakeholder communities and what's important to them, since as I said earlier, we're all moving in the same direction, but the specific priorities for providers might be different from families and from individuals. So we want to understand those differences. But outside of that, no, there's nothing else that we're looking for to identify specific individuals who complete the survey.
Thank you, Stephen. We have a question from Susan. Is there any danger of the legislature reducing funding in the future because we have additional federal funding?
That's a great question. And that's why the supplement, not supplant language is so important, because states have to adhere to that in order to get the funding. They have to show how they adhere to that. So I think it's going to take some education, but basically that is not allowed if you are going to receive the funding. You cannot supplant the current. So it's kind of like a maintenance of effort.
Thank you, Mary. Next we have, is the fund associating with slash covering retainer payment extension mentioned as part of the 30 million?
That the retainer payments can be an option for using the funds. Steve, would you agree with that?
Yes, that I think that would fit under the guidelines that CMS established, that we could use those funds to extend retainer payments.
Let's see, do we have any other questions? So far, a lot of the questions that are coming in are in regards to the link to the survey and how we will be disseminating it. But if there are any other questions, we will be glad to take them. Let's see. Oh, this is a great question. Are there any strategies that will assure ongoing funding post American Rescue Plan Act funding?
So that's another really good question. As we consider these options, we have to have an eye on sustainability. Some of these things are projects that can be implemented and completed within the 3 years, but depending on the options that we choose, some will need much longer term strategies to be put into place. And so that has to be part of our planning. Stephen, you want to add anything to that? Everybody's asking, who's Stephen? What is he? Stephen has been a consultant to us on the waiver for many years, I would say about 5 years now, and has his company led the rate study for us, and he's helped us on a number of efforts, including education for legislature. So we're really so happy to have him with us and his skill set. And that's Stephen. And then another question here, I know we have to wrap up, is can you begin sharing out the survey today? Yes, it is live, correct, Stephen?
It is.
Ready to rock and roll, guys. So I think if we could go back to the slide deck, there's a couple more slides on if you have additional questions.
All right. All right, everyone. So we'd like to thank you again for joining us. Let me pull up the slide deck here. If we happen to miss your question, we will be pulling up where am I? We will be pulling up some information in regards to how you can go ahead and submit that to our team. But again, thank you for joining us today. I know we requested your attendance on such short notice, but should you have additional questions for us, please feel free to reach out to the email you see on our screen, and that is doh.dddpossibilities@doh.hawaii.gov. We also included in the chat a link to today's presentation, so feel free to download it. And again, all of this information will be archived on our main screen at DDD, health.hawaii.gov/DDD. All right, thank you everybody for joining us today. Mahalo.